This is a classical wound breakdown due to not burying the final knot, or from an Aberdeen that unraveled. I have always struggled to make a neat fresh skin incision using the scalpel blade. I find it easier to use sharp, curved, surgical scissors and just trim around the edge. It is better if you can do it with a blade, as the scissors slightly crush the skin. I give a margin of about 4 mm around the edge. This should give us nice fresh healthy skin. We want to see it like this: vascular skin that's bleeding. So we close the fat layer, picking up the middle as we along and in a continuous pattern. The suture material unexpectedly snaps. There should be enough throws, so it stays intact, especially if you compare it to Glasgow Uni's recommendation for surgeons, which is to follow with just a scary 2 throws. We now make another ligature and follow a continuous pattern, finishing with a surgeon's knot with 4 to 6 ones. We then snip both the tips and start the intradermal with a different anchor. As this is a wound that has broken down, the chances of breaking down will be slightly higher. Therefore, we do an extra layer, a subdermal layer. This brings the wound together more, taking some strain off the intradermals. This is the surgeon's knot at the end of the subdermal layer. We hide the knot by going close to it, just slightly caudal then deep into the wound, coming out right at the end. We snip the small tail so it is non-existent, otherwise burial is difficult. We wiggle the needle through the wound, just in front of the knot. Lift the skin over the needle, so you exit some distance form the suture, especially if it's an Aberdeen. Then as you are pulling gently on the suture, push the skin over the knot with forceps.